Hello, everyone, and welcome. My name is Corey Thornton. I'm the Managing Editor for Market Intelligence at Open Minds. Today, as part of our weekly Executive Web Forum series, Open Minds Vice President Richard Lewis and Senior Associate Cathy Gilbert will present how to build a win-win payer partnership, marketing, negotiating, and contracting with health plans. Before I turn it over to them, I would like to go through some housekeeping reminders. While your audio will be muted for today's briefing, we're prepared to make this an interactive session. If you have any questions at any time during today's forum, please enter those in the GoToWebinar question box, and we'll be glad to answer them. Also, the slides and recording for today's briefing will be available on the Open Minds website starting tomorrow. And with that, I'd like to turn it over to Cathy.
Hi, everybody, and thank you for joining us. And once Corey pulls up the slides, we'll get started. There we go. Okay, so as Corey indicated, Richard and I are going to talk about today building win-win payer partnerships with health plans. I come to you from the health plan side. So I did this for a couple health plans over the years and kind of give you my experience and what I looked for. And Richard will also provide color from his experience working on the provider side in these relationships. So hopefully we can answer your questions and provide some information that will be helpful to you in your relationships with the plans. And next slide, please, Corey. So during the webinar, we're just to give you an idea of the agenda at a high level, we'll talk about outreach and engagement with plans, how to prepare a pitch deck, how to negotiate the agreement, and then how to maintain those relationships once you have the agreement. And then give you a little bit of information on a couple tools that Open Minds has available that may be helpful for your organization. So next slide, please, Corey. So a little background on the topic. So for health plans, one of their focuses is moving to value-based reimbursement as a part of managed care arrangements. They're an integral part of healthcare, and I think they're going to be part of the healthcare for the foreseeable future. Managed care really kind of got started back in the 80s, and it's continued now we're going on 40 years plus. So I think it's here to stay with different flavors such as value-based reimbursement. So provider organization executives, you have to find a way to position yourselves to work closely with the managed care organizations, align services to meet customer needs and what MCOs see as their challenges, and then support the services you provide and build the relationships with data and metrics to show the outcomes that your organization has. So we're going to talk about all of those as we move through the presentation today through the different perspectives. And next slide, please, Corey. So outreach and engagement. Talk a little bit about where to begin. So next slide, please. First, you have to start by knowing your status with the payers in your market. So your approach is going to vary depending on your relationship or your current status with the payer. You may have relationships with your local community mental health centers or regional centers, or you may have relationships with your Medicaid MCOs, with commercial managed care plans or health plans. So you have to ask yourself some of the questions. First, identifying, okay, what plans do I have a contract with? Am I in their network? Am I getting referrals from those plans? What % of my business are those plans and those payers? Do you have a relationship with regular communication, or is it more that you're just a part of their network and you're listed in their directory, but you don't have a regular key contact? It's important to develop those, at least have somebody that you can go to or know who your key contact is at the organization for anybody that you do have a contract with. And then the other piece you need to look at is, okay, I may work with the Blue Cross plan and, Optum Medicaid in my market, but are there other plans, regional players in my market that I may need to work with? Have you received referrals from them, even though you may not be in their network? Do you know anybody at that payer? Whether through professional organizations or community, it might be your neighbor, but do you have a contact with the payer that you might be able to leverage? but know what other plans are in your market is a key component. So know who you're contracted with and already participating with, build that relationship, and then identify other payers that are in your market that you may want to have a conversation with, that you could build a partnership with. Okay, and next slide, please, Corey. So the other piece you have to know as you're beginning to build know your relationship with payers and know who you want to build a relationship with. Also, you need to know your competition in their market, in your market. So it's not just knowing the payers, it's knowing who else is doing behavioral health services or similar services in your market. So your main competitors in your main geographic area. The other piece to look at, which is a little bit changed, especially since the pandemic, is to also know who may be offering telehealth or virtual services in your market. They may not be physically located in your specific geographic area anymore, but they may be offering virtual services. Know what's there. Do a brief assessment of your competitors, noting any changes in their programming or capacity. What's happening. Be aware of that, your competitors in the market. With the pandemic, this is especially true, but know what competitors may have closed or eliminated some service lines, or their capacity is limited due to the pandemic. That may create new business development opportunities for growth or expansion, or opportunities to partner with a health plan where that provider or your competitor discontinuing a service may create an opportunity for an expansion for you, especially with a health plan that may need to be using that services. Also contact local health plan and government payers to explore new provider network service needs due to that competitor downsizing. Or could be changes in a waiver and new services they're going to be covering, but keeping tabs on those things. Having all of that information in your arsenal is important in your conversations to the health plans. Some national payers may actually be looking for local providers to help them understand the market or learn the market. So that's another way you can build your relationship with those payers in those conversations. Next slide, please. So, and then here's the next step in that, taking all that information, understanding that concern that may have, as a result of the information you learned, that creates a concern for the health plan as a result of the pandemic or in general in what's going on in your market. So closure or downsizing of contracted provider organizations that limits their consumer access, which behavioral health services we already know. There are gaps in care and limited resources, which for the health plan, that increases client dissatisfaction. They'll be hearing from their clients or members that, hey, I can't get an appointment for the service I need. The other thing is with new providers coming into the networks, payers are concerned that providers may not have a full understanding of managed care principles and how a payer might work. It's really important to understand the administrative processes and when you're partnering with a health plan. And then when you have more new providers in your network or providers working with different providers, there's limited data that they have to build performance-based or value-based reimbursement models because they have new provider organizations, so they don't have information about a provider's performance. That's where you can come in and present your data on outcomes and initiatives that you may have within your organization, not necessarily with that payer's membership, but in general, showing the efficacy of the treatment that's provided by your organization. Their other concern is that they're going to see an increase in utilization of more expensive, higher levels of care, more emergency room visits, more inpatient, maybe due to lack of access or discontinuation of some of the outpatient programs or services that might have been available, closure of practices, reduced hours. There's also potentially that they have members with treatment disruptions that they're concerned about, or they may need case management for complex conditions when they cover an SMI population. So these are all concerns the payer's looking at that they're going to be thinking about as they're meeting with providers or determining whether or not they should engage with provider organizations. Okay, and at this point, I've kind of gone through the first section. Any questions, Corey, that we might have had during this first section?
Not yet, Kathy. The crowd seems content to listen for a while. I'll check back in with you later.
Okay, sounds good. Thanks, Corey. And with that, next slide. And I believe I turn it over to Richard at this point to talk about taking this information to prepare a pitch deck. So Richard, over to you.
Thank you, Kathy. Next slide, please. So one tool we wanted to share with you today with regard to making it easier for outreach and engaging is the payer partnership concept statement, or in non-consulting terms, just a pitch deck. And we've learned over the many years that providers have difficulty oftentimes with getting a hold of health plans, getting a hold of people to talk to, and being able to set the stage for those conversations about new contracts, expanded contracts, those types of things. So the payer pitch deck, and that's what we'll call it for what we review this section, really is just a really quick snapshot of your organization, and it's a way to get your foot in the door to start those conversations. It may be, if you're a new provider, you need an introduction meeting with a plan. If you already have health plan contracts and for rate negotiations or even contract expansion conversations, having that pitch deck as an update to your organization for the plan executives that you'll be meeting with is very helpful. And it's also a good way to update them on any new service lines you may have, any changes in service delivery models, those types of things, especially right now as a result of COVID. As many of our programs and services may have changed. Another real value of the pitch deck, and we're going to get into detail about what a pitch deck is it provides the plan folks that really quick 10 PowerPoint slide overview of the organization that they can share amongst themselves. You may be talking with a health plan contract manager, and maybe you're looking at discussing expanding a service line, maybe looking at some type of value-based reimbursement arrangement. That person's going to have to meet with potentially provider relations folks, network management folks, clinical folks within the plan organization, and having that ability for them to share this pitch deck with all these other folks at the plan is really valuable, and helps them just to see very quickly who you are and what you provide. It's a brief snapshot of the organization. We've learned over many years that health plan folks they're really busy, and they're not going to go to your website and click in all the different tabs and try to figure out who you are and what you do. They want to see something that's concise, that just says, here's the organization, here's their service lines, here's their innovations, here's their value positioning, just something really down and dirty. And lastly, the pitch deck really demonstrates to a health plan that you as a provider organization understand what health plans need. You understand how health plans work, because this deck is really oriented towards solving health plan problems, and they'll be able to see that in this deck. So so that's part of the other value. Next slide. Next slide. So we talk a little bit about your pitch deck as a tool to addressing health plan needs. Payers are looking for providers that are coming up with new ideas, new programs, that are interested in partnership in either new contracts or expanding contracts. They're looking for you to be able to address their provider network gaps in service and deficits, your ability to manage complex populations, which oftentimes are costly to the plans. They're interested in your specific, innovative treatment approaches, your care coordination ability, your consumer engagement platforms that you may be operating. They're interested in knowing that you're ready for some type of value-based reimbursement opportunity possibly, and that you're able to provide outcome and performance data to them, which is very, very meaningful nowadays, especially as we're starting to see more and more value-based reimbursed type contracts. Next slide. So the components of a pitch deck, and again, if you can picture just a 10-slide, graphically appealing, colorful snapshot of your organization, we call the pitch deck. These are some of the elements that we recommend would be in there. Some type of an introduction slide that talks about your interest in unique positioning in the market. Some information about your organization at a high level, mission, vision, values, who are the key executives in the organization so they know who to contact, and maybe highlighting any program innovations that you may be offering. You may have recently developed some type of an integrated program that includes behavioral health services with primary care. That's something you'd want to highlight, things of that sort. We want to talk a little bit about the populations that you serve, especially if you're serving complex populations or those that have, moderate to high acuity type disorders and things. Health plans want to see that you're able to work with those types of clients and have programs and services for those folks. We talk about outcomes data, and we're going to talk a little bit more about that in a minute. Excuse me, but any kind of clinical outcomes that you may have, any client satisfaction survey results that you may have. Some providers survey referral sources, they survey families, they survey staff. All of these things are things that you want to pick out some of the highlights and the high scoring outcomes that you may have and would want to include in a pitch deck like this. Value-based contracting and management capabilities, and we'll talk about these things in a second, but things that are going to highlight a customer-centric intake admissions process, a process that's going to make access to care and treatment, easy and easy for the client or easy for a health plan to make a referral. That we have the revenue cycle management, bells and whistles in place to be able to do health plan billing. And of course, we talked a little bit about the tracking, the outcomes and tracking and providing clinical outcomes and those things. And again, this deck really is designed to highlight really who you are, and it's really a capabilities deck. It's not a selling kind of a marketing deck as much as it's introducing to a payer. These are my capabilities as an organization and how I'm positioned to solve your problems. Next slide. So we'll talk about a couple of these things in a little more detail. We're not going to delve into every element that we just reviewed, but some of the highlights. The organizational review, maybe 1 or 2 slides, and it's just in very concise, clear language. It's at a glance. Who is you? Who are you as an organization? Are you adult provider? Are you youth? Are you outpatient? Are you residential? Profit status, number of years in business, your accreditation and certifications should be on that slide. What does your footprint look like? Where are your locations in your market, in your county, in the states that you may serve? It may be national, just a map showing all of these things. Health plans like to do business with organizations that have a large footprint to be able to touch as many members, as many of their members as possible. We talked a little bit earlier about core program competencies. If you're a residential treatment provider, we're not going to spend too much time on a whole program description, but really residential treatment as a category, and maybe just some of the highlights of what a residential program, your residential program might offer. And again, anything that's innovative. When we're talking about programs and things, we want to highlight any evidence-based practices that you may be using in any of your services. The plans, the payers like to see that you're using those things. It demonstrates quality. And again, we talked a little bit about mission, vision, values. You want that in there to give a real feel to the payer of the type of organization, who you are, and those kinds of things. Next slide. So your service lines, I mentioned a second ago that we're not going to get into a real full-blown program brochure type of thing. A slide or two or three, and maybe you have 3 core service lines, and maybe there's a slide about each service line that just highlights what that program provides, the populations that are served, those types of things. Some of the examples here on the bottom talk about let's just take outpatient mental health services as a category. We like to recommend that you highlight first those things that health plans traditionally pay for, and maybe just in a fee-for-service contract, outpatient therapy, individual therapy, group therapy, and the populations that are served. Highlighting your cadre of licensed behavioral health professionals, especially if you're in a workforce shortage area. The fact that you're bringing more licensed capacity to that plan and to their members is a big plus. 24-hour assessment, your ability to see clients quickly. You have psychiatrists. If you're working with children and adolescents and you have, let's say, board certified psychiatrists, you want to highlight that. Those types of folks are always in demand. And in your service line descriptions, we always want to talk about your ability, what your case management system looks like, that you have linkage to community-based social supports, that you're addressing social determinants, which is becoming a growing importance for payers, especially when we're working with complex clients. Next slide. Program care coordination and service delivery innovations. No 2 providers look alike. Every provider is different in size and scope, in the types of services you offer, in the way you deliver services, the types of partnerships you may have in a community for additional, treatment supports and social supports. So you really want to highlight the things that make you special, that make you unique. Again, care management, care coordination or case management is critical. Health plans want to know that you've got that ability to track a client throughout the treatment continuum, that you're constantly engaged with their care managers, with families, with community stakeholders because of discharge planning. All of these things lead to a smooth, discharge process, linkage to lower levels of care and community, and ultimately for the plan result in hopefully, reduced recidivism, especially into psychiatric hospitals, emergency departments, things like that. Highlight telehealth and virtual consultation, especially nowadays. Because of the pandemic, we saw a huge surge in providers having to move into that, using those types of tools, and the embrace of health plans with increased rates and new contracts for telehealth and virtual consultations, so that they could keep their provider networks intact and available for their members. Integrated and whole person care approaches. Big movement right now towards contracting with providers that bring that whole person approach, the integration of primary care and other services, especially for complex clients that may have behavioral health issue and a co-occurring drug and alcohol condition, or a serious mental illness and 1, 2, or even 3 comorbid medical conditions. These are the types of things that are catching the eye of health plans, and that they're moving towards value-based reimbursement models. And consumer access, we talked a minute ago. If anything that's related to making it easy for health plans to make referrals or clients to access, we're seeing a lot more providers creating website portals, creating virtual assessments. Again, things that are going to make it easy for clients to get them in quickly for assessment and into treatment. And lastly, anything that you do with regard to crisis services and social supports, these are things that, combined with a good aftercare program and case management system, we know reduce utilization of psychiatric hospitals due to mental health crisis episodes. So just throwing out some examples of things you really want to include in your pitch deck if you're doing any of these or all of these things. Next slide. So health plan readiness is a concept that really somewhere in our deck we want to be able to talk about or illustrate to a payer that we are health plan ready. There are providers, for example, who have never had a health plan contract and are new to working with a health plan. It's more important for those types of providers to kind of take a look at operational systems to make sure you have some of these things that we've listed here in place. These are all the operational systems that you'll need to be able to do smooth, health plan business, referrals and assessment, concurrent review, billing, collecting deductibles and copays, the whole 9 yards. And the areas of focus would be clinical operations, things like having a case management system and the ability to do concurrent review with a health plan. Intake and admission systems that, again, are maybe 24/7. You've got some kind of a portal so folks can go online and schedule an appointment immediately. Those types of things. Marketing and business development is very important when we're working with the health plans. That ability to have marketing folks or a team that are working to develop referral networks, potential referral sources in the community, especially if they are referral sources that have a high volume of a specific plan member. So working with the EAPs and the large employers that contract with Anthem. So you're going to want to reach out and have folks that are working with the EAPs and large employers that may have potential referrals for you. Revenue cycle management, we just mentioned a minute ago, being able to do the billing and collections, and you have systems for that. Most EHRs nowadays have all of those pieces for you. Leadership and human resources, we want to make sure leadership understands managed care principles and understands what the payer needs and expectations are in these types of contracts. Information technology, having EHRs, metrics management and QA, being able to to manage the track, collect, and report on important data. And then margin management as an organization, that has a lot to do with being able to know your costs and positioning yourself for success in future value-based reimbursement type arrangements. Next slide. I won't spend too much time. Again, outcomes tracking and reporting. In your pitch deck, you always want to have at least one slide that talks about you have this capability, you are tracking data, you are able to report, and then any of the clinical outcomes, any of the outcomes data that you have. And I mentioned earlier before, your clinical outcomes, patient satisfaction, intake and assessment, data that you have showing low no-show rates, those types of things. Anything that really addresses, the big 5 major HEDIS measures that most health plans are focused on right now, and some of them are listed here: timely access to care, reducing hospital readmissions, reducing unnecessary emergency department visits. Customer satisfaction is one of the top 5 for plans. So just addressing this in the pitch deck is important. Next slide. Before I turn it back over to Cathy and she talks a little bit about negotiating agreements, are there any questions from our audience about the things I just talked about with regard to pitch decks?
Not yet, Richard, and I think this is a great time to remind everybody on the call today that if you have any questions at all, Richard and Cathy would be glad to answer them in real time. If you would also like to wait to the end, we can address them at the end. Thanks, Richard.
Okay, thanks, Richard. And now you've gotten the pitch deck, and now you've gotten to the point where you need to negotiate an agreement with the plan. So let's talk about what that process looks like. For example, starting with the contracting process, there's the solicitation, which is kind of the pitch deck, and talking to the plan about your capabilities. And then usually the plan will send you a credentialing application and a contract to review. Now, this process can be concurrent, or it could be they negotiate the contract, and if the contract's going to work, then they'll send you the credentialing application. Every plan does things a little bit differently, so you'll have to ask them about how the process works. So that's always a good discussion to have when you get the contract. So you get the contract, then you're going to want to negotiate rates. The plan will typically send you, for outpatient services, especially on a fee-for-service basis, they'll typically send you their standard fee schedule that they have published for outpatient services with an agreement. For other levels of care, it's a negotiation, and likely the plan will ask you for a proposal for those services. So you need to understand ahead of time your costs and how much it costs you to provide that service, so you can propose a rate to the plan for that service. So it depends on the type of service that you might be negotiating. And the plans have ranges for what they'll pay for certain levels of care. So you can have that discussion with the contract negotiator. And it depends on the line of business, the type of contracts they have. Usually there's a Medicaid rate, there's a Medicare rate, there's a commercial or rate, which would be like their employer groups. And then there may be a rate for their HMO type product. So there could be, 4 or 5 different fee schedules for the same service, depending on the product type. So then you'll work through that rate negotiation process, and you could get their standard fee schedule for the outpatient levels of care, and those don't really cover your costs, or they're not what you expected. It's fine to propose additional rates back to the plan on those services. So you will have negotiation. The next part is you need to read that contract and read what's in it, so that you understand all the things in the health plan contract. There'll be things in the contract like how much time you have after providing a service to submit a claim. If there's coordination of benefits involved, there'll be requirements about participating in their quality activities. So make sure you read and understand those. They will also, typically health plan contracts, incorporate their provider handbook or provider manual into the contract by reference. So it's important to take a look. The provider manuals are usually published on their website. So it's important to ask for the link to that provider manual and review that provider manual in conjunction with the contract. So you have that, so that's all part of that process, the contract language negotiation, rate negotiation, and then you get the signed contract. Now, at the same time you're getting that signed contract, you may be going through a credentialing process where you have to submit a credentialing application to the payer to review your license, your accreditation. In the case of some outpatient services, they may offer a group practice contract where they actually have to individually credential the clinicians in the practice, the licensed clinicians. So there's all of that process that will need to happen as well. Once a provider is credentialed and the rates and the contract is signed, the plan will then fully execute the agreement. And then it's time to implement or operationalize that particular contract with that payer. So it's important that there's a plan for implementation, but that's the basic steps of process for contracting. Next slide, please. So that's the process. So what you have to do is, after you've developed this pitch deck, is really determine what payers you're going to target. It could be payers you're already contracted with that you've realized you need to renegotiate your rates. It could be new payers. So you identify the target payers and health plans in your market that you want to contract with. You build that relationship that starts with that pitch deck. Make sure they know about your outcomes and are a partner. Don't be afraid to ask about the programs they offer, including preferred provider networks, centers of excellence, and I'll talk a little bit more about those as we go through the presentation, but don't be afraid to ask. Initiate contact with the personnel responsible for contracting. That could be provider relations. It could be through facility contracting. Each payer has different people that are responsible for that, so that you'll have a specific person that you'll work with through the contracting process. You make sure you send your information. Regarding your services, your organization offers, and that value proposition. So you may want to, as you're negotiating the contract, you may present more data. They will look at it at the granular level. They'll want to know, your outcomes broken out by your commercial payers versus a Medicaid population, because they want your outcomes to be tied to the type of membership that they have. You need to build your own story. And if they're offering a value-based contract, make sure you have your data as well as theirs if it's a plan you already work with. Don't totally rely on the payer's data. You want to have your data and make sure it aligns. And measure based on, and then once you're contracted, you want to make sure your measurements are based on each payer's specific members and lines of business, and broken out by lines of business. So through that solicitation process, these are all the things to be thinking about. You may not and be planning for of different things that could come up during that negotiation process, especially if you're looking at a value-based arrangement with a payer you're already working with. Next slide, please. So there are different types of payment arrangements, and your contract with the payer could be any of these. Standard fee for service, very traditional. You provide a service, they pay you for that service. An enhanced fee for service is an arrangement you may have with a payer for something that you do that your organization specializes in, or for certain things that fill a payer needs, such as same-day access to appointments, or meeting their HEDIS score, certain HEDIS scores. If you perform at a certain level in some of the HEDIS measures that Richard identified, they may pay an enhanced fee for service, a higher fee for service reimbursement rate. There's a lot of times the value-based type of arrangement. They will look at those for ongoing compliance and meeting the metrics, usually HEDIS, to maintain like a preferred provider designation. They could vary. There could be case rates, typically with higher levels of care or for something programmatic. There could be bonus payments for meeting certain standards for a period of time. There could be shared savings with or without risk. And then capitation is obviously with the full risk of you're capitated to make sure all those services are provided for that member, and what your capitation is what you get to make sure that that happens. The most common things I'm seeing in payment arrangements in the behavioral health space right now, they're seeing some case rates. I'm seeing some kind of earn your increase, where you meet certain metrics for this year, next year when we will increase your rates by a certain percentage point, or it's the enhanced fee for service. So those are the kinds of things I'm seeing the most. I think there's going to be more unique arrangements coming in the near future as behavioral health moves into more of a value-based arena. Next slide, please. So when you're finalizing the contract language, your measures, negotiation, finalization, they're between the health plan and the provider organization. Make sure they're very well defined. The metrics are specifically defined in any contract. So if they're for fee for service or to become a preferred provider, or a metric as a VBR arrangement. What are the metrics? Know what those are. Not only what is the metric, but the methodology for calculating those metrics. You want to note that in that addendum if you're looking at a value-based contract. Calculation is going to be based on this time period, based on, say, claims received or submitted by such and such a time, so that you are very clear on what the methodology for calculating those outcomes or the measures. Is it a specific, is it a change in GAD-7 scores or PHQ-9? What are those measurements and how are they going to get there? You want to be clear on which populations and plans are covered under that arrangement. Is it their Medicare members? Is it Medicaid members? Is it commercial plans? You need to know that information. And then also talk about a data sharing. What are the timeframes and process for data sharing? You don't want to get to the end of the year and you think you have a value-based arrangement and you've been tracking all year and you think you're right on target to meet that metric, to earn that bonus or earn that increase or maintain your enhanced fee schedule, to find out that the plan's data somehow differs. And since the plan is on the end of controlling those payment structures, you may not get that increase. So make sure there's timely data sharing throughout the year for tracking, maybe quarterly meetings to compare data and make sure you're on track. Make sure you have a resolution process for any data discrepancies between what you may have and what the payer data is on the metrics. Make sure you're measuring them the same and you've defined a resolution process. And as I mentioned, a framework for meetings to talk about that data. Make sure that you're all in sync and you're seeing the same level of outcomes, which ties to your value-based arrangement. So it's not just that you get a value-based contract, you have to monitor it through the year and make sure your data aligns with what the plan is seeing. I know some plans are starting to put out report cards, or so you get your data and you can measure that, but you want to make sure you understand how they're calculating, what the information they're providing on those report cards, what the data set is that it's coming from. Okay, and next slide, please. So, and this is just something to think about, plans are looking for value. So what is value? It's the quality plus the service divided by the cost. And that's what, so thinking about that, plans are looking for value. So it's not always just the price point. They're willing to pay more if they're getting a quality service with outcomes at a cost that still, it may reduce cost for another area, but that's how they're looking at it. That's the value. So next slide, please. But defining that value can be challenging. It differs by stakeholder, by the payer, the provider, the patient. So that's one of the things when you're having these conversations with the payer, make sure you learn to capture the measures of value that align with each definition. So, and that's all part of defining your metrics. For payers and organizations, value can be defined by cost savings and resource utilization. For healthcare providers, value can be found in workflow management and clinical outcome improvements. And for members, however, value is tied to the experience and the outcome of the care. So you have to think about all of those things and then defining the value. And that's some of the things that are going to be built into the metrics that plans are looking for. Richard mentioned client satisfaction, provider satisfaction. They look at those scores. Those are important, as well as their HEDIS measures. So next slide, please. Oh. Sorry, my screen flipped. So using these definitions with payers, you have to correctly define each measure and capture the data. So some of those things are, Richard mentioned, HEDIS scores, there's Medicare stars, patient satisfaction surveys, net promoter scores. The net promoter score is a newer measure of satisfaction, where it's, would somebody who has received services from you recommend you to someone else, to family or friends? I used to call that the mom test. Would you send your family there? but that net promoter score is a score that they're really looking for. Access and appointment availability. Payers want to know when they call you, when a member calls you, they can get an appointment, and they have standard guidelines they're looking for. They're looking for routine appointments to be available within 7 to 10 days, and for urgent appointments within 3 days, emergent, non-emergency room, but with emergent need within 6 hours, and obviously emergency room is immediate. And then outcomes data with evidence-based practices. And you can use these data sets to present your value propositions to the payer. So you have this information about your organization. You can look at the measures in HEDIS and Medicare Stars and use those to measure some of the outcomes you have within your organization. Next slide, please. So payers take that data and then they develop their preferred provider networks or centers of excellence. Their preferred provider organizations are first to be considered for value-based contracts. There's a focus on, they will look for high cost, high volume diagnostic categories for value-based contracts, or to find programs that really have good outcomes with those challenging diagnostic categories that are costly. To drive members to those organizations. For facilities, they'll look at higher levels of care. They look for specialized diagnostic categories. Maybe it's for substance use disorders. It could be for eating disorders. Could be depression, or major depression. So different specialized diagnostic categories. They'll look at outcomes by that. For outpatient groups and practices, they look for evidence-based practices. And CBT, those types of things, the ones that show good outcomes, and outcomes as compared to other practices with a similar patient mix. So that they're looking at all of that within their data. And then from those providers, when they see providers performing well based on some of these metrics, those are the ones that may be identified as preferred provider organizations they reach out to for value-based contracts, or when they're looking at developing a center of excellence program for a specific diagnostic category or treatment program, these are the first providers that they're going to reach out to. So you want to be able to start demonstrating that so that plans think of you when they get a question like, hey, we need to send somebody somewhere. It's not just the relationship with the network team, it's a relationship with the clinical team. So that they remember, oh, that they had really good outcomes. They were good to work with. We have a relationship with them, so that you can get those types of referrals. Next slide, please. So this is just kind of a slide to give a little detail on a preferred provider organizations understand payer goals and expectations. So I mentioned the Net Promoter Score, but they look for timely access to care, delivery of quality services. They coordinate with the client care with essential social supports, measurable, impactful service line clinical outcomes. They focus the customer service at multiple engagement points. There's the payer, the client, and the referral source. And then there's aligned payer and provider goals. And then this positions you for repeat business. You have timely access to care, you get that patient in, you meet those needs, and it maintains your referral cycle. So it's a key way to think about keeping that going. And next slide, please. So what are the strategic implications of having, you get through this, you become a preferred provider, you get to a value-based contract, you develop competencies and an internal culture to compete in a performance-based market. You develop the infrastructure and the information technology to realign your processes and assure you have the data to show your outcomes. You improve your understanding of your cost drivers so you can manage and reduce your costs, but you know your drivers, so you're negotiating contracts that will cover your cost and allow you to grow your business. And then you accumulate enough savings to cover changes in the new payment process and reward your caregivers, your therapists, because you're able to continue to build better reimbursement and better outcomes for members. Next slide, please. So the next time, so you've gotten through all of that, what do you need to do to maintain that relationship with the payers? So you've got your contract, maybe it's value-based. You really need to treat your MCO as a partner, not as an adversary. So it's communication. You develop relationships, as I mentioned, not just with the network team, but also with the clinical team. You make sure you have periodic meetings with the MCO clinical staff. Those could be facilitated by the network team. Some payers have what they call provider partnership staff. They could be negotiated through that group. Those are usually clinicians, but to have those conversations, keep apprised about the plan and their needs and how you can help them. When you're hearing something from their members, really work with the plan to say, hey, we're hearing this from your members. How can we help? Keep them informed about you. Let them know when something new is happening. Make sure that key people at the plans are on the, the email list for your newsletters or updates about your program. So you keep yourself front and center. Track your outcomes, share your data, talk about your accomplishments. This includes your accomplishments beyond your VBR metrics, but really communicate that so the plans know what that's all about. Next slide, please. And then this is implementation internally once you have a contract, what you need to do. We talked about all the things that are in a contract, including the provider manual. Make sure there's a setup to implement that contract within your organization. So making sure all the appropriate departments know the provisions of the contract that might be of impact to them. What are the codes you bill? What are the reimbursement rates? What are the authorization requirements? Where do you submit authorizations? What is the payer portal? There's all these things that are really important to managing and working with the payer. The signed executed agreement is sent to the person responsible for managing the contract. Conduct a training and in-services to review the health plan's administrative and clinical policies. Maybe develop some administrative and clinical tools to assist line staff in effective management of the contract. It could be a resource that you have available that tells your staff what the requirements are of the different contracts and where to go for information. Schedule regular meetings with the payer for review and status. And for some payers, if you don't do a lot of business, it may be just an annual touch base, but for a payer where you have a value-based reimbursement, you're going to be doing enough business with them that you're going to want to have, I would suggest at a minimum, some kind of a quarterly meeting. And assure regular reporting on an internal dashboard to monitor your metrics. So you're monitoring on a regular basis, not just at the end of the quarter, not just at the end of the year, but you're regularly getting data and reporting on the outcomes that you're achieving. Next slide, please. So now I'm going to turn it over. First, any questions so far? We've covered quite a bit of information.
Thanks, Cathy. You guys have covered some great information. I actually have a question for you. People in the audience today, how do they find the correct contact to begin to build the relationships with payers that are necessary for these VBR agreements?
That's a lot of times you have to ask. But I use people that I know. It doesn't matter if you know, even if you happen to know a neighbor who works for a plan, if they're a care manager, they may know who the network person is that they work with. They might be able to tell you a name. Leverage those contacts. A lot of times some payers actually post on their websites, on their Join the Network page, a contact information. So you may find it there. They may actually list the actual individuals. So it may take some research on your part, but it also may be through other providers or through your personal contacts to find out who the exact person is. The other way is I do a LinkedIn search and look at the personnel that say they work at that payer and look for certain titles. Like you look for a network director, or you look for even a clinical director, a network manager, a provider relations specialist. Look for some of those titles at that organization on LinkedIn, and you can message people that way, or at least you might get a name, and you can go through an 800 number for the plan and ask for a specific person. A lot of times you can get to them. So there's many ways to get to a person to at least get you an initial contact. Okay.
Thank you.
You're welcome. And I think I'm turning it back over to Richard to talk about managed care readiness.
Yeah, they certainly don't make it easy to reach out to them, Cathy, which is why when you do get a hold of somebody, the things we're talking about today, having that pitch, that getting something in front of them that they can say, wow, this is someone I want to talk to, is so important. Next slide. So we're at the tail end. We're pretty much at the end of our presentation. We wanted to talk about couple things, and one of them I mentioned earlier in something we wanted to point out that may be useful to you, to providers that are on today's call, and that is the Open Minds online managed care readiness assessment. I talked earlier about health plans wanting to know that provider organizations have the operational systems in place to be able to do good health plan contracting and engagement with their members. And there's on the Open Minds website, there's a link. There's an assessment you can take. I think it's about 106 questions that covers all these different domains, and it produces a really good report in terms of strengths and weaknesses and opportunities from your answers, and gives you a score with recommendations for areas that you may want to improve on, or that are satisfactory, or that are doing really well just the way they are. So their managed care readiness is real important to plans, especially in today's world where everything's managed care, and some providers are still trying to learn what that means from an operational standpoint. Next slide. And I'm turning it over to Cathy.
Right, and another tool, once you have managed care readiness that Richard described, is to assess whether you're ready for value-based reimbursement. So this is another online tool that Open Minds has available that helps you assess if you're ready for managed care. And again, it will give you a score, or for value-based reimbursement, it'll give you a score and kind of give you some recommendations on things that would help you be ready for value-based reimbursement. So talking about provider network management, clinical performance, access and engagement, financial management, your reporting infrastructure, and leadership and government, and the different things that you need in those areas to be ready for value-based reimbursement. So it's another tool that Open Minds has available that could be very helpful if you've already managed care ready and ready to move to that next level. Next slide, please. I think, Corey, that's where Richard and I can turn it back over to you. If there are any questions, we have a couple minutes left. We'll be happy to answer those.
Absolutely, Cathy, thank you. And you guys talk about how important this communication process is. Should a provider organization just hire a marketing person whose sole responsibility is to try to manage these relationships, win these, gain the ear of a payer, so to speak?
And Richard, I don't know that it's just a marketing person. There's a broader skill set and a knowledge of healthcare that goes with this.
Yeah, and to that point, Cathy, I think having what we would call an account manager, a point of contact for your organization to be able to work with the health plans, who really becomes an expert in talking to them, their language, what their goals and needs are, contracting processes, credentialing, referrals, care management. All of these things are going to be fairly similar plan by plan. And having that single point of contact for the health plan to be able to reach out when there's questions or issues or concerns is really, really important. So that's the first piece of marketing, if you will, is in developing that strong relationship with the plan, is having that person. Now, that could be somebody in your marketing team, on your business development team. It could be somebody from another department in your agency. Secondly, at some point, you are going to want to bring on board or have some staff available to actually do community-based outreach and marketing, not only to the payers, but to also to the potential real referral sources that are going to be feeding these programs with plan members.
Yeah, and I would say one of the things I'm seeing is it's the title they're starting to come out with that's similar to an account manager for health plans, but they're calling them payer relations and contracting specialists is the topic, but it really is an account manager who specializes in working with health plan payers, whether that's a regional center or a health plan, but that's really their specialization.
Cathy, Richard, we have run out of time. I want to thank you again. And I want to remind everybody that we are here every Thursday. We're back next Thursday, May 6th at 1 p.m. And we will discuss how to use government RFPs and winning proposals for competitive advantage. And that will be a deep dive into the Open Minds government database, featuring our very own Mina Dyak and Cody Brumgard. I also want to remind everybody that we will have the slides and video for this up starting tomorrow. Richard, Cathy, thank you again. Thank you everybody for joining us.
Welcome.
Thank you.
Have a good day.
Mhm.